Have you ever woken up with a strange, nagging pain in your shoulder, neck, or face, and just brushed it off as a bad sleeping position? Or maybe you felt a sudden, dull ache behind one eye, or a mild headache that felt off, but figured it was just stress. Most of us wouldn't think twice about these discomforts. But what if I told you that this common pain might be the very first warning sign of a stroke? Yes, a stroke, one of the leading causes of disability and death in adults over 50. And the pain we ignore or dismiss as nothing serious could be the body's way of screaming, "Help is needed." Now, today, we're going to uncover one of the most overlooked early signs of stroke, a type of pain that often goes undiagnosed until it's too late. You'll learn what this pain feels like, why it happens, and how to tell when it's time to act fast. Because recognizing this one symptom could be the difference between life and death, or between recovery and lifelong disability. Stay with me until the end of this video, because what you're about to hear could one day save your life, or the life of someone you love. Stroke is often portrayed in dramatic terms: sudden, slurred speech, half the face drooping, or someone collapsing in public. And yes, these are real classic symptoms. But here's the truth. Some strokes begin with pain, not speech issues, not paralysis, just pain. Specifically, pain in the face, head, neck, or shoulder region. And because it doesn't match what we've been taught to expect, people ignore it. They go to work, they sleep it off, they take a painkiller, when what they really need is to get to an ER. Let's take a real example. Frank was a 62-year-old retired teacher. Healthy, active, never smoked. One morning, he woke up with a sharp ache behind his right eye. It felt deep and pressing, almost like a headache, but it wasn't. He assumed it was a sinus issue or maybe eye strain. He took a Tylenol and moved on. That evening, the pain had migrated to the side of his face and jaw. Still no numbness, no slurring, no weakness. But the next morning, everything changed. Frank's wife found him on the floor, conscious but unable to speak. His right arm was limp. He was rushed to the hospital. The diagnosis? A left-sided ischemic stroke. Doctors later told him that eye and jaw pain? That was the beginning. Your body was trying to tell you something was very wrong. So what does this pain feel like? Exactly. It's not always intense. In fact, it can be subtle. That's what makes it dangerous. Here are the key descriptions people have reported before a stroke. Sharp pain behind one eye. Dull or throbbing ache on one side of the head. Burning or tingling sensation in the jaw or cheek. Sudden neck stiffness or tightness without injury. Pain that feels deep inside rather than on the surface. Sometimes it mimics a tension headache. Other times it's mistaken for TMJ, a pulled neck muscle, or even dental pain. But the key difference is that it feels different than usual, and it often comes on suddenly and without cause. But wait, why does this pain happen at all? Strokes are about blood clots, not nerves, right? That's partially true, but when a blood vessel in the brain starts to narrow or block, it can affect nearby pain-sensitive structures. The trigeminal nerve, which controls facial sensation, the blood vessels behind the eye, which can trigger sharp, deep pain, or the meninges, the protective layers around your brain, which can cause sudden head pressure. In some cases, the pain is from mini-strokes called TIAs, or transient ischemic attacks, where a clot briefly blocks blood flow, then clears up. These episodes don't always leave visible damage, but they are massive red flags for a full-blown stroke within days or weeks. Here's the frightening part. When people experience these early warning pains, most don't seek help. Why? because we've been conditioned to think stroke is always dramatic. But in reality, 20% of strokes start with pain alone, without any other obvious symptoms at first. That pain can last for a few hours or a few days, and by the time classic stroke symptoms kick in, it might be too late to reverse the damage. That's why experts emphasize the golden window. You have about 3 to 4.5 hours from the onset of a stroke to receive clot-busting treatment like TPA. But if you wait to act because you didn't recognize the pain as a red flag, you could miss that window entirely. Let's be honest. Everyone experiences headaches, neck tension, or a sore jaw from time to time. So, how do you know when that pain is just life and when it's a red flag? The answer lies in 3 key factors: suddenness, uniqueness, and progression. 1. Suddenness. Stroke-related pain tends to come on suddenly and without a clear trigger. You're not dehydrated. You didn't sleep in a strange position. You didn't have a stressful day. The pain just appears, out of nowhere. 2. Uniqueness. This pain often feels different than what you've experienced before. People describe it as weird, deep, unnatural, or scary. If you've had migraines before, this doesn't feel like those. If you've had neck issues, this seems unlike your typical stiffness. It's new, it's unfamiliar, and that matters. 3. Progression. Unlike tension headaches or muscle pain that improve with rest or medication, stroke warning pain may gradually spread or worsen over hours, especially as the underlying blood flow disruption gets worse. Sometimes it starts behind the eye. Then the cheek feels hot or tingly. Then your jaw aches. Then you notice your words feel sticky or your balance feels off. That's when you need to stop everything and act. Now, let's talk about who should be the most alert to this kind of warning sign. If you're over 55, you're already at higher risk for stroke. But several factors increase that risk even more, especially in the presence of these unusual pain symptoms. High blood pressure, the #1 risk factor for stroke diabetes, damages blood vessels, increasing clot risk. Smoking thickens blood and narrows arteries. Heart disease or atrial fibrillation can cause clots to form in the heart and travel to the brain. Family history of stroke. Genetics play a role, especially in early strokes. Sedentary lifestyle, poor circulation, and higher clot risk. High cholesterol leads to narrowed or blocked arteries. If you check even 2 or 3 of those boxes, and you start feeling sudden, strange facial or head pain, that's your cue. Don't wait and see. Get checked. Now here's where it gets tricky and, frankly, frightening. In a study published in the Journal of Neurology, researchers found that up to 15–20% of patients who suffered ischemic strokes had pain as their only initial symptom. That means no numbness, no drooping, no slurred speech, just pain. One woman in her 52nd reported a strange burning feeling on one side of her face that lasted a few hours, then went away. She didn't think much of it until 2 days later, she collapsed at work. Her MRI showed signs of a small stroke that had likely started days earlier. The lesson? Pain alone can be enough reason to act, especially if it fits the pattern we've discussed. Sudden, unusual, progressive, located in the eye, face, jaw, or neck, occurring alongside common stroke risks. So, let's say you or someone you love feels this kind of pain. What should you do? 1. Don't wait to see if it goes away. Time is brain. Every minute that passes means more brain cells die if a stroke is underway. 2. Don't drive yourself to the ER. Call 911. Paramedics can start treatment and get you to the right facility faster. 3. Don't take aspirin unless told to by a medical professional. Aspirin can help in ischemic strokes, but it can worsen bleeding in hemorrhagic strokes. You won't know which one you're having without a scan. 4. Tell the ER staff this. I'm worried I might be having a stroke. I had sudden facial, head pain, and I'm at risk. This tells them to prioritize immediate imaging like a CT scan, which is crucial. Here's the hopeful truth. Stroke doesn't always hit like lightning. In many cases, the body gives us warnings. Not in flashing lights, not in sirens, but in subtle ways like unusual pain. If we start paying attention, if we treat that pain not as an inconvenience but as a signal, then we may just catch strokes before they cause permanent damage. Because sometimes the first sign is not slurred words or a drooping face. It's a quiet ache behind the eye, or a strange tingle in the cheek, or an unexplained tightness in the neck. And that small pain could be your second chance. By now, you've learned that some strokes start with pain and nothing else. But let's take it one step further, because there's an even more subtle form of stroke that often completely flies under the radar. They're called TIAs, or transient ischemic attacks. You may have heard them referred to as mini strokes. And here's why they're dangerous. TIAs mimic strokes but resolve within minutes or hours. There's no permanent damage yet, but they're not harmless. In fact, a thanks in advance is the brain's last warning before a major stroke. About 1 in 3 people who have a thanks in advance will go on to have a full-blown stroke, many of them within just 48 hours. It's like hearing the fire alarm chirp quietly, but ignoring it until the building is in flames. Common signs of a thanks in advance include a few minutes of confusion, temporary slurred speech, brief weakness or numbness in an arm or leg, unexplained head or face pain that disappears, a sudden off feeling, as if something isn't quite right. Even if those symptoms vanish in an hour, you must take them seriously. Getting checked after a thanks in advance could give doctors time to prevent a larger, more damaging stroke. And then, there's the truly sneaky kind. Silent strokes. These are small strokes that don't cause noticeable symptoms at all. No drooping, no pain, no warning. But they still kill brain cells. And over time, multiple silent strokes can lead to memory loss, trouble thinking, and even dementia. Often, people discover they've had one only by accident during an MRI or CT scan for something else. Scans reveal small spots of damage where blood flow was briefly cut off. The bottom line? You don't want your first sign of stroke to show up on a brain scan. That's why tuning into any unusual pain or sensation is so crucial, because it may be the only clue you get before a major event. Now let's turn this knowledge into power. Here are 5 things you can do right now to lower your stroke risk and respond fast if symptoms show up, pain included. 1. Know your numbers. Get your blood pressure, cholesterol, and blood sugar checked regularly. High blood pressure, especially, can silently damage your blood vessels for years. 2. Get moving daily. Even just 20-30 minutes of walking a day can improve blood flow and reduce stroke risk dramatically. 3. Don't ignore pain in the head or face. If something feels strange, sudden, or off, don't just mask it with painkillers. Ask yourself, is this different from what I normally feel? 4. Train your family. Teach your spouse, kids, or neighbors the signs of stroke, including the unusual ones we've discussed today. Print the fast checklist and stick it on the fridge. Face drooping, arm weakness, speech difficulty, Time to call 911. And now, add an extra P at the front. P equals pain that's sudden, strange, and unexplained. 5. Have a plan. Keep emergency contacts and medical info easily accessible. If you live alone, consider a smartwatch or medical alert system that lets you get help fast. Let's circle back to Frank, the man who ignored the pain behind his eye. He survived. And after months of rehab, he regained most of his speech and motor skills. But he'll tell you himself, "If I had listened to that pain, I might have walked into the hospital instead of being carried." His story isn't rare. It's happening every day to people who are busy, tired, or simply unaware. But it doesn't have to happen to you. Pain is the body's alarm system. And when it rings, especially in the head, neck, or face, pay attention. Because when it comes to stroke, your only warning might not be dramatic. It might just be a quiet ache at the wrong time, in the wrong place. And if you catch it early, you might just stop a stroke before it ever begins. If you found this video helpful, please consider sharing it with someone you care about, especially if they're over 50 or have any stroke risk factors. This simple knowledge could save their life. Subscribe for more science-backed health content that keeps you and your loved ones safe, strong, and informed. And don't forget to hit the bell so you never miss an important health alert like this one. Thank you for watching. Stay aware, stay well, and remember, even small pains can have big meanings.